I've had several calls and meetings with my senior staff, economic development weeks. Our unemployment rate is now at 4.9%. It is number 6 in the United States for lowest unemployment rate. We are also number 8 in the nation for job recovery, at 63% of the jobs recovered here in the state. Consumer spending remains at or near pre-COVID-19 levels. We are in constant contact with companies wanting to relocate to Missouri. Thanks to our balanced approach and Show Me Strong recovery plan, we are outpacing our economic forecast, and we continue to make progress every day. For a COVID-19 update, Missouri's 7-day average for new cases as of yesterday is approximately 1,700 per day. Using the CDC method, our 7-day positivity rate is 11.6%. Using the state method, it is at 23.5%. As I said last week, both of these rates are now reported on our public health dashboard. For hospitalization, the 7-day average is roughly 1,400. However, I want to assure you that overall our healthcare system is still meeting the demand. Of Missouri's 22,000 total hospital beds, 49%, nearly half, are still available. We also have nearly 70% of ventilators that are still available. We are extremely thankful for that the vast majority of Missourians are recovering, but we know there are still many that are suffering and families that have lost loved ones. Our hearts and prayers are with them. Last week, we met with Cox Health on the new saliva-based COVID-19 test. We also discussed some of the biggest challenges facing our hospitals right now. Areas like Springfield are seeing a lot of patients transferred in from smaller hospitals in surrounding communities, putting additional stress on systems like Cox. During our meeting, we talked about empowering rural hospitals and equipping them with the tools to care for more COVID-19 patients, which would help relieve some of the stress on our largest hospitals. We are looking into ways that we might do this, such as the ECHO program with the University of Missouri. Our healthcare workers, rural and urban, have been on the front lines for almost 8 straight months. They are tired and overwhelmed, but they continue to rise to the challenge and take care of Missourians. We cannot thank them enough for their efforts, and we will continue doing everything we can to support them. On the testing front, we continue to expand capacity across the state. We now have 2 confirmed locations for the saliva-based testing machines developed by Washington University: Truman Medical in Kansas City and Cox Medical Center in Springfield. In addition to these, WashU's own machine, the 2 others we have will go to Central Missouri and Southeast Missouri. This week, we began shipping Abbott Rabbit testing to K-12 schools across the state. Nearly 330 schools and districts applied for the test through DESE, requesting a total of nearly 583,000 test kits. These tests are a less invasive nasal swab that can give results in 15 minutes. Many schools will be performing these tests on site. Some others have partnered with their local health department or medical provider to administer the test. Missouri expects to receive a total of over 1.8 million tests. With the election quickly approaching this week, we know there are a lot of concerns about voting safely. Yesterday, I had the chance to meet with the St. Louis County Board of Elections and Secretary of State Ashcroft to review new COVID-19 safety measures for Election Day. And I want to assure you that our county clerks, poll workers, and local election officials are taking every precaution possible to make sure Missourians can safely cast their vote. We received great feedback from voters on the primary election in August, and we are confident that the general election will be successful as well. We are also focused on protecting our election integrity. We are proud that Missouri has always had very fair and secure elections, and as with every election in our state, we are committed to safeguarding the process. We are coming up on 9 months of dealing with COVID-19 here in our state. And I want Missourians to know that we continue to work extremely hard for the people of this state. A tremendous amount of work has been accomplished since March. I encourage everyone to take a look at a new page on our website highlighting all that has been done. From education to public safety to child care and families, mental health, high-risk populations, the economy, and much more. Since day one, our entire cabinet team and state workers at every level have gone above and beyond the response to COVID-19. And as a thank you to our state workers, state offices will be closed on Friday after Thanksgiving. We hope that our state workers can take this time to rest and spend time with family and loved ones. I want to thank not only our state workforce, but our healthcare workers, teachers, law enforcement, child care providers, grocery store workers, truck drivers, and all Missourians on the front lines. All Missourians have played an important part in this, and we are so thankful for your efforts. And it does not stop here. We must continue to work hard. We must continue to social distance, wear a mask, and wash our hands. We must continue to push forward while protecting ourselves, our families, and our neighbors. Together, Missouri will overcome these challenges. Thank you, and God bless.